Saskatchewan health officials have been saying for several days that it was a possibility, and now it's happening. COVID-19 patients are being transferred to Ontario as this province struggles to deal with record-breaking numbers of intensive care patients. One patient was transferred yesterday. The other 5 are expected to be moved by the end of tomorrow. For more on this, we're joined now by Premier Scott Moe. Good morning, Premier.
Good morning, Stephanie. Thanks for having me this morning.
Thank you for taking time for us. Doctors are calling this a disaster on an unimaginable level, a catastrophic failure of policy. What's your response?
This is a challenging time for our province as we find our way through the fourth wave of COVID-19. There's a number of measures that have been introduced just over a month ago now that are proving to be effective in lowering our case rates. They're even lowering our hospitalizations, but unfortunately our ICU numbers continue to increase, and that has precipitated the decision ultimately that we have made early this week to transfer 6 patients out to Ontario to alleviate some of the pressures that we have in our ICU capacity across the province.
This is obviously a last resort. Why didn't you avoid this by acting sooner?
Well, that's a fair question, and I'd said that yesterday. Should the government acted 7 or 10 days sooner with the
or 2 months
with the public health measures that we had put in place that are proving to be lowering our case trajectory here today, and so
we're not really talking a week or 10 days. We're not really talking a week or 10 days. Doctors were flagging you months in advance, and in fact, every medical health officer you have signed a letter August 26th, and you didn't do anything for 22 days afterwards.
We most certainly in the middle of September did.
September 17th you took that measure, but August 26th they told you, please do it right now, we're in big trouble. August 26th they said that.
Right, and we had discussions through our health minister, through the leadership at the Saskatchewan Health Authority, as well as with Dr.
It was Dr. Dunorf at the Health Authority who begged you to do it in a letter.
And Dr. Shahab is our Chief Medical Health Officer for the province of Saskatchewan.
What's he saying you should
provide advice to the health minister and ultimately to the government of Saskatchewan that we acted on. Yes, in the middle of September, and as I had said, should have we acted a week or 10 days sooner with that advice?
It was 22 days earlier that you got a letter, and weeks before that, the doctors were calling for this.
Yeah, you had mentioned that earlier, that there was a letter that came from the chief medical health officers earlier. As I said, that did precipitate much of the discussion that happened in the days following between the health minister and Dr. Shahab and the government proper and Dr. Shahab, and ultimately the action that did come together in the middle of September, bringing back the masking mandate and ultimately moving. And Saskatchewan was one of the earliest provinces to move on the proof of vaccination policy, making it effective October the 1st. We still see some provinces that are just now bringing that into effect, and that is proving to be an effective policy.
It is proving to be effective, yes, Premier, but you said that it would violate privacy rules initially.
That is why we have moved not just with a mandatory vaccination policy, but have provided the option for a negative test result, which does provide for a safe workplace or a safe environment or a safe event, but then also does provide Saskatchewan people with that choice moving forward.
Why didn't you do that sooner, knowing it would work?
Well, we did move on it as soon, virtually. I think there's maybe only one other province that had put it in place before Saskatchewan did, and so we were one of the early adopting provinces.
But not in your messaging, sir. You and the health minister said that this was a matter of private choice. The health minister said it would violate people's human rights, and you said it wouldn't be possible due to privacy, but you found a fix.
We did with the negative test policy that does still provide people in this province a choice. We look at other provinces where we see healthcare workers that ultimately are being mandated or losing their jobs. That isn't the case in Saskatchewan. There is a choice, and so we did take some time to ensure that the policy was correct and also implemented very early when you compare to
September 1st in Quebec.
Implementation.
September 1st in Quebec.
Which was the one province that was ahead of Saskatchewan.
What about Manitoba?
We're seeing the federal government, who has not yet
Manitoba was early September too.
Either.
right? Manitoba was also early September.
Right. So we have two provinces that were implemented before.
So they're adding up
BC
here.
has come on later. Alberta has come on later, and so Saskatchewan was one of the early adopters of this policy. And as I said, we've had about 125,000 vaccines that have been delivered since that policy has been brought in, which I think is a tremendous increase from where we were in the weeks previous. And so it's been a positive policy, and I think it's come together, quite well, and it will have an impact on us as we move forward through the next number of weeks and months.
Right. I guess it would have had a mitigating effect if you'd done it sooner. We might not be sending people out of this province right now.
Yeah, Quebec had done it a month sooner, and so as I said, had we moved a number of weeks sooner with that policy and the masking policy, it would have had an impact ultimately on our ICUs, as it is having an impact even today. We see on our numbers, and our hospitalizations are down the last 10 days as well. Yes, a fair question. Should have we acted a week, 10 days, maybe even 2 weeks sooner?
3 weeks, 4 weeks?
Well, as you said, it was a couple of weeks.
22 days at least.
22 days, 3 weeks.
22 days when the letter was written. And of course, we heard people speaking publicly in July about this to you, saying this was...
The letter came 3 weeks and 1 day ahead. I apologize, Stefani.
Yeah. So, but even in July, you were talking about this being a very good place as cases were rising and people were asking you to put more measures in the summer.
There is people that are always going to act.
No, doctors, not people, doctors. Doctors.
People, including doctors, that are always going to ask for additional measures here in the province. And the fact of the matter is the government has a number of tools that are available to them now, not only in public health measures to keep people out of hospitals, and we're going to have additional tools in the weeks ahead. And enacting, very blunt instruments like public health measures across 84% of Saskatchewan residents that have, made the right decision of going out and getting one shot, 75% 2 shots. They may not always be the most effective measure as we move forward. We're going to make testing, rapid self-tests available to Saskatchewan people as soon as we're able to receive them and disperse them. We're going, as Public Health Canada introduces early intervention treatments such as monoclonal antibodies, we're going to make those available to Saskatchewan people as well.
What about gathering limits, as Alberta has? Right now in Alberta, if you're unvaccinated, you can't get together with other households.
And Dr. Shahab, I would think as recently as yesterday and in the lead up to Thanksgiving weekend, had made some recommendations around gathering limits and had asked people in Saskatchewan to keep their bubbles small. And what we're seeing in the numbers here today is
that's not a public health order. Why don't you make it a public health order as it is in Alberta? Why don't you underscore Dr. Shahab's recommendation with a public health order?
Well, we don't do everything that Alberta has done. We have charted somewhat of a different path here in Saskatchewan.
You've got the highest death rate in the country.
If you look back throughout the COVID pandemic, that just simply isn't true.
You've got the highest death rate in the country right now.
Are we having a challenge as we find our way through the fourth wave of COVID-19 in Saskatchewan? Most certainly we are. I think that is obvious with the decision that we have made yesterday. And I think but as we look ahead with the tools that we have in Saskatchewan and we look at the trajectory of the numbers here in the province, I think Saskatchewan's situation is improving.
Well, the cases are down, sir, but we think testing is down. ICU is at record capacity day after day, and we've seen from the sewage tests that it looks as though cases are actually up. What guarantees do you have that people are just not getting tested? Dr. Susan Shaw says 55% of people who show up at hospital very sick haven't been tested before they get there.
That's been consistent throughout the last number of months, and the fact of the matter is cases are down. They're not. Yeah,
but you just said that they're not being tested. Cases are down because 55% of people don't bother getting a test.
Cases have been on a downward trajectory for the last number of months. Our hospitalizations as well.
ICUs are at record highs.
I understand that, Stephanie, but our hospitalizations over the course of the last 10 days.
But sir, you're sending people out right now. The whole point of bending the curve was to keep our capacity in healthcare, and we don't have any anymore.
No, and that is unfortunate. And if you look back to and is the reason why we had brought in the public health measures that we did in the middle of September with the information that we had at that point in time. You had
information 3 weeks and 1 day sooner, as you've already said in this interview.
We also had information at that point in time that it indicated our Saskatchewan Health Authority was going to expand our ICU capacity to 175 beds. And for obvious reasons, we've not been able to attain that. We've gotten to 125 with the implementation of the Emergency Operations Center. We've increased that now to 135 beds. We're making all of the early intervention treatments that we have available, the testing capacity that we have available, bringing in non-mRNA vaccines and public health policies that, quite frankly, are not only reducing the case numbers that we have, but public health policies that are increasing our vaccination rate.
Doctors say the only thing that really matters is how many ICU patients there are, and we don't have room for any more, as you know, because you're sending at least 6 out. Could be as many as 40 or 50 or 60, doctors say, to really get the job done. Why would you ask the U.S. for help before the federal government of this country that was offering it?
I think where the discussions at the Operations Center, our Joint Command Center, came was they were talking with all provinces, and through the channels and the groups and the tables that they have those discussions with, there was some of the states in the U.S. were included at those tables, and the federal government also was included as they were talking with the Federal Emergency Operations Center as well. And so there was multiple discussions going on with respect to, is there bed capacity for us to transfer, some patients out if it was required, and it turns out this week it was. And are there human resource capacity that can be ultimately transferred into Saskatchewan? And so it wasn't just talking with U.S. states and not the federal government. It was talking with all of the relationship, using all of the relationships that Saskatchewan has, and talking to everyone that is at that table.
All right, sir. I know you have to go right away, so I'll just ask you before you do. Why is Jason Kenney in Alberta sorry, but you haven't said so yet?
Well, I think, to all of those individuals that are, being impacted by the service slowdowns that we are experiencing here in this province, there's people that are waiting for, for example, hip, knee surgeries, other surgeries that are deemed non-urgent, but most certainly, I think, in fairness, are urgent to those that are waiting for those services. And to all of those, kids, for example, that are waiting for therapy, whether it be physical, speech therapy, we have had to slow down those services in Saskatchewan due to largely unvaccinated folks that are
many of whom are kids.
No, not in the hospitals. Many of the impacts are to kids, yes, but due to unvaccinated people that are using up those services, mainly in our ICU beds here in the Saskatchewan, for certain. I am sorry that we have experienced those slowdowns here in the province, and the government is and continues to do everything that we can to ensure that those services are available to Saskatchewan people as soon as we are able.
Thank you, sir, for your time this morning.
Take care, Stefani.
That's Premier Scott Moe. If you have